Good afternoon, everyone. Welcome to the first session of the GA. So I will kick things off. Jesus will also make a very short presentation during this first session. So next slide, please. Next one, please. Thank you very much. And I will kindly ask who is controlling the slides to help me with the build-up. I'd like maybe to start saying that this is indeed a very special year for us, not only for negative reasons, as Jesus will elaborate later a little bit in terms of the impact that COVID had on the project, and of course, in addition to the impact that COVID had on the society in general and in the life sciences field. But also a good year for us because we will grow more in beginning of 2020 to 21 to 22. Harmony is no longer one project. We are now have a twin project, an extension of Harmony based on our successful application and grant of Harmony Plus. And we will have a dedicated session tomorrow on that as well. So Harmony stops being a 5-year project to have at least a 2-year extension. I'll kindly ask for a click. We also stop being a project that focuses on 7 main therapy areas to cover all hematological malignancies in terms of scope. We still remain, of course, a grand European project covering 17 European countries. We also increase in terms of the amount of available budget in order to execute our vision from 40 million to an additional 12 million. We retain mainly the structure in Harmony Plus, the inherited from Harmony with more than 90 partners. And more importantly than the dimension and the volume of partners is that we are truly covering all major health stakeholders, academia, industry, payers, HTA agencies, regulators, and patients, not to mention, of course, within the industry field, very important tech partners as well, which are so important for this big data project. Now the click, and basically, we are also hitting or aiming to hit our objective of 100,000 cases by the end of 2021, and I'm pretty sure Jesus later will also speak a little bit about our current progress on that stage as well. Next slide, please. Thank you. But more important than the numbers that we have about the internal metrics of the project, most importantly, the numbers that we want to have is the insights that will help us support patient care, better patient care. And this image actually helps us visualize the way to get there. So it's a very nice infographic that was done last year. Click back, please. A very nice infographic that was done last year that hopefully explains in a very simple way the process to go from data to insights. It starts, of course, always with the very dear data holders, hospitals, biobanks, pharmaceutical companies that hold either interventional and non-interventional study data that, of course, are fed into our big data platform, are processed first, and then analyzed in our platform in order to achieve the objectives and to support the decisions that you see on the right-hand side. Next slide, please. And indeed, Harmony is breaking boundaries by doing essentially 2 things without huge precedent in Europe. From one hand, pioneering a big data approach to a specific therapy area, and especially one that is comprised of conditions that have very low prevalence in the case of hematological malignancies when, of course, compared with solid tumors. But at the same time, a very collaborative approach while doing it. So like I've already mentioned this today, but this is very important. We continue to strive to involve all stakeholders. We're talking about a truly public-private partnership, both sides co-leading all work packages, this will be the same structure in Harmony Plus. Of course, the focal point of Harmony is data sharing. Like I said, not just clinical trial data, but also observational data sets from both public and private partners. And while I understand that it's difficult from all partners to actually be sharing data, we appreciate the effort that has been done, and we will try to find technical and governance solutions to enhance the data sharing in the years to come. Our really objective is to overcome the sometimes internal inertia that companies and institutions have in order to gain external trust. And also very importantly to note is that Harmony is really not in this space to compete with other research projects. We have taken a very collaborative and very open stance. We are engaging in looking for synergies, exploring synergies with complementary research efforts. We are here to progress science and to collaborate in trying to do that. Finally, and very importantly, we have shared research projects. So it's not like the data is pulled together and then everyone goes and does their own analysis. We have cross-functional teams from different institutions working together. And of course, the more data that we have and more people that we have working in the data, the more insights we will be able to generate under and achieve our vision. And also very importantly is the issue of, and the topic of transparency. It's very important to us that all proposals are visible, and especially also that all results are available to all partners and to the scientific community in general. And I'll finish by going back to the point that I started with. Harmony is enabled and starts with patient data. We are a big data project. But data is not the end goal. Data is the substract, is a very important ingredient to achieve what we want, which is basically generate insights to support patient care. So everything that we do should always be done with the perspective, with the vision on the end product, the end result, which is to impact positively patient care. So thank you very much. I'm very happy to then take any questions after Jesus' presentation as well. Back to you, Jesus. Jesus, I think you were on mute.
Can I have the next slide, please? Okay, we will have a look on the results in this special and difficult year. This overview of the 2020 started in fact in 2019. In which, next slide, please, we had the midterm review. The midterm review was in the middle of November, and we have a panel of 3 experts who made, I think, an in-depth evaluation of the Harmony project at that time. And they found let's say from their comments, they found it very positive, the results coming showed by Harmony in this at that time. We have the infrastructure for the data platform. We have the patient cluster established under Leukanet, making the complex project management manageable for patient groups. And also we have established several links to other big data for better outcome projects, mainly with the Pioneer project, who is mainly focused in prostate cancer. And the negative points mainly regard several recurring problematic topics in Harmony, as for instance, the problem in the deliverables. We are a little bit on delay in resolving most of the deliverables that we have to manage. And this is it was evaluated as a negative point. We have to increase the number of the data set provided by the FPI in the consortium. This has been a point in which we have made some progress this year after some discussion in the executive committee and the steering committee. We have to prioritize activities with higher impact, and also we have to focus in obtaining real-world evidence data and clinical trial data. And the recommendation coming from this panel, this review panel, was to apply for 1 year extension at no cost. And this is something that must be also discussed and approved by the General Assembly, by all the members of the consortium. So in fact, and in summary, better than worse reports, but always room to improve. Next slide, please. And during this year, we were mainly, as all this society and most in our case as clinicians, by the negative impact of the pandemic. And also Harmony made some proposals trying to adapt our platform to receive data coming from COVID-19 patients, but also to have a specific focus project in COVID-19 affecting hematological malignancies. In this way, tomorrow we will see the presentation of two new projects, one coming from Professor Barbui regarding the COVID-19 impact in patients with myeloproliferative disorders, and the other will be presented by Dr. Pagano about the epidemiology of COVID-19 patients in hematological malignancies. So in fact, we have adapted our project to this new scenario, and in this way, it is also important to know it, to share with you that Harmony was offered the service as a platform for big data to also, in case that some clinicians really want to share the data, to really receive data coming from patients with this disease. Next one, please. In any case, the activity was in some way, well, at least presentially, was really very much reduced. But on the other hand, we made contribution, and we have some specific meetings at the EHA virtual, recently at the ELN in September, and also we will have participation at the ASH meeting this next December. There has been some communication already said by the scientific committees in those really important international congress. Next one. And also we have been adapted all the presentiality to the virtual scenario now with the COVID-19. And in fact, we have developed some seminars, some webinars. The first one was in June with a high participation of Harmony partners, but also it was open for a general scientist and patients, and we received I think about over 150 participants in this webinar. And also we have many other participation in another meetings rather than the previous one. So we will continue to have these meetings, this focus meeting this month, later this month, and also the idea will be to organize focus meeting by disease in order to see how is the progress and to stimulate also the discussion inside the different pillars. And now with the new incorporation of new diseases in Harmony Plus, it will be more and more important. Okay, Harmony Plus, it was the dream from Harmony for the very, very beginning, and we reached finally at the beginning of this month. We have the kickoff meeting on October the 5th, and we, as you really know, in Harmony Plus, we will expand the scope to all the hematological malignancies. we are also expanding the capabilities of the platform, integrating historical control harms. We will offer a rapid analytic to the health care stakeholders, and we will continue the collaboration with other projects. And now we will again restart the meetings with the ASH Data Hub, who is mainly focused in myeloma. Next one, please. Can I have the next one? Okay, in summary, and regarding the number of patients already transferred, it is actually, we have in the database almost 30,000 cases. From ALL, we almost reach 10,000 cases. Next. For myeloma, we are going to have 8,000 cases. Next. For AML, we are now over 5,700 cases. Next. For CLL, we are in almost 4,000 cases overall. Next one. For MDS, the numbers are not so high, but MDS is also a less prevalent disease. We now have 1,400 cases. And non-Hodgkin lymphoma, we have to improve here in Hodgkin lymphoma. Next one, please. In non-Hodgkin, we don't have yet 1,000, but I'm quite sure that we will increase these numbers. Can I have the next? Totally, we are almost in almost over 28,000 cases. Next one. This is regarding the cases already transferred to the database. In addition to that cases, we also have 18,000 cases already committed to be transferred in the next weeks or months, regarding sometimes with the problems, with some problems more in relation to the signature of the documents that also affect all the different diseases, MDS over 6,000, and myeloma 6,000, AML 3,000, and so on and so on. Can I have the next one? If we see these numbers and how is the evolution of the cases already committed, and this is the blue line, or transferred to the Harmony database, that this is the red line, we can assess that at any year we have almost double than the previous one. So it is really a nice evolution that we have to assess and to keep in mind that they are real patients, they are real data coming from, let's say, sometimes clinical trial, but also from the real world data from the hospitals. Now we have a double number of cases already committed and almost 3 times more cases transferred to the Harmony platform. So it is quite important to have this in mind. Next one, please. So, and now just to provide a general vision of this assembly, again, I repeat for those who really attend later, it is a real pleasure to have all of you here in the virtual General Assembly. I hope that, and we, the Executive Committee, hope that these, let's say, these barriers coming from this virtual scenario will not avoid the possibility of a really in-depth debate between us. We can use the chat, we can use also the normal questions. Now we will have time for the discussion of the different diseases. Last year in Florence, we have a very nice, a very good discussion, disease by disease, with new projects that has been a little bit stopped in the last months, maybe due to the pandemic. Now it's time to restart these efforts, to restart these projects in the different diseases. It is quite important now. The database is fully operative, and the results are coming, and the results are start to be shown in the main international congress. We will meet in parallel in these 6 pillars, and later in the next step, we will come back to this general forum to have some presentation regarding the Delphi surveys that they are ongoing in the Harmony project. Next one, please. Next one. And for tomorrow, we will start also at, can you go back one, please? For tomorrow, no, back, not ahead. Okay, perfect. For tomorrow, we will start the meeting again at 3 p.m. We will talk about sustainability, which is one of the most important challenge that we have to resolve now, and we will need an in-depth discussion. Michael Muller will make the presentation. Michael Muller is the CEO of Stradu, who is the company who is providing support and advice in these sustainability topics regarding Harmony and Harmony Plus. And later on, we will have some other topics regarding the future perspective, including Harmony Plus, and also the new projects coming to Harmony that we really want to share with all of you, some of them regarding COVID-19, and other mainly focused in myeloproliferative disorders or MRD in AML. In summary, welcome to the meeting. I hope that you will enjoy. Please trying to really work in the discussion. We have to consolidate the projects already ongoing in Harmony, but also we need to have these new ideas with new projects now that the data are there, and we have to use this data from the patients. Thank you so much. And now we have to distribute in these 6 rooms. Thank you so much to everyone, and welcome to the Harmony General Assembly.